Hello friends, in this video we will talk about a case. So a 4-year-old boy is brought to the emergency department with dehydration. He has had several days of decreased oral intake and today his parents could not get him to drink anything. The patient has received no vaccination due to parental beliefs. Vital signs are normal except for mild tachycardia. Physical examination shows decreased skin turgor and sunken eyes. His jaw muscles are tight. Neurological examination shows increased tone throughout and 3 plus patellar reflexes. There is a small healed puncture wound on his lower leg. And the father says that the boy fell on a piece of chain like fence in their backyard last week. So the question is, release of which of the following transmitters is most likely to be directly impaired in this patient? Now let's solve this case. So the patient has received no vaccinations, means um, it is prone to infections. Then his jaw muscles are tight, means there is increased tone of muscles. Then 3 plus patellar reflexes and the small healed puncture wound on his lower leg. And father also says that ball fell on a piece of chain-like fence in their backyard. Now we have to figure out the neurotransmitter which release is inhibited. So if acetylcholine is inhibited, it leads to flaccid paralysis. And dopamine and glutamate has no role in the toxin effects on the body. Then if you inhibit glycine is a inhibitory neurotransmitter. So if you inhibit glycine, result will be uh, increased tone of muscles. Serotonin has role in the cholera, in the infection of Vibrio cholerae. So here the answer is glycine. So now let's talk about the infection. The infection is due to the Clostridium tetani infection because of the unvaccinated child following a puncture wound. It is a non-invasive and by producing exotoxins such as tetanospasmin, uh, it first binds to the receptor on the presynaptic membranes of peripheral motor neurons. Then from here, it migrates by retrograde transport. Here you see in the image that the retrograde axonal transport is occurring. Then it goes to the motor neurons and then it will inhibit the release of GABA and glycine neurotransmitter. So it will inhibit the inhibitory effect of neurotransmitters. So it will increase in the tone of muscles and it will cause the muscle spasms and hyperreflexia. The keyword is that lockjaw, opisthotonus, etc. are the keywords for the Clostridium tetani infections. And here the explanation is that serotonin released from enterochromaffin cells in the gastrointestinal tract is stimulated by Vibrio cholerae enterotoxin. This increased serotonin release contributes to the extreme fluid secretion gene in cholera. So now let's see what is written in the first aid. So let's talk about the Clostridia. It is a gram-positive spore-forming obligate anaerobic rods. Obligate anaerobic rods means it only survives in the anaerobic conditions. Tetanus toxin and botulism toxin are proteases that cleave snare proteins involved in neurotransmission. Now, talking about the Clostridium tetani, pathogen is non-invasive and remains localized at the wound site. Produces tetanospasmin, an exotoxin causing tetanus. Tetanospasmin spreads by retrograde axonal transport to CNS and blocks release of GABA and glycine from Ranso cells in spinal cord. So, if you inhibit GABA and glycine, which is an inhibitory neurotransmitter, it will result in spastic paralysis, trismus meaning lockjaw, risus sardonicus, raised eyebrows and open grin, and opisthotonus, spasms of spinal extensors. Tetanus is tetanic paralysis. Prevent with tetanus vaccines. Treat with antitoxin, positive or negative vaccine booster, antibiotics, and diazepam for muscle spasm and wound debridement.